Hi there, I'm Dr. Leah Light from the Brainchild Institute. And today I want to talk to you about middle ear problems in young children and how they affect them in terms of their development. So the first 6 months of a baby's life are probably the most important time for their hearing to be as best as it can be, and unfortunately a lot of our babies are having ear infections at that time. And when they have middle ear fluid, sometimes it's not an infection, sometimes it's just fluid sitting behind the eardrum. They don't hear as well as they're supposed to. It also interferes with their balance development too. So many children will have trouble learning how to sit up or crawl, things like that, when they have fluid in their middle ears, or they'll have abnormal crawling patterns. When children have fluid in their middle ears, oftentimes it can be related to a number of different things, such as allergies. Milk, in particular, cow's milk, has been shown to contribute significantly to recurrent middle ear fluid or infections. So some children not only have fluid in their ears, but some children have negative middle ear pressure. Negative middle ear pressure happens when the eustachian tube, which is a tube that runs from the middle ear to the back of the throat, is not opening and closing properly. You are all probably aware of your eustachian tube, because if you've been on an airplane before and your ears were all clogged up upon descent of the airplane, that's your eustachian tube kind of getting stuck closed, and the pressure on the inside of the eardrum and then on the outside in the ear canal, outside of the eardrum and the ear canal, need to be equal, or you have this push-pull effect on the eardrum. And when the eardrum is very stiff like that, then some sound actually hits it and bounces out the ear canal, and so the child doesn't hear properly. They might still pass a hearing test, but it doesn't mean that they're hearing normally, because you know what it sounds like when your ears are stuffy. It's a little distorted. For an adult that's had years and years of language experience, we can still compensate around that pretty well. But for children that are developing their sound encoding system and learning new vocabulary and language, it's a real problem. Even a mild hearing loss is a big problem for kids with middle ear effusions or fluid. If you suspect your child has middle ear fluid, you should also always contact your pediatrician and have this checked out. A simple test called a tympanogram is a very quick and easy test. It's painless, and it oftentimes can tell us if there is fluid present. When we look into the ear with our little otoscopes, it's only a little monocle, and we sometimes will miss middle ear fluid. We can see eardrums that will appear to look normal, but we really don't know until we run a tympanogram. So make sure you ask your pediatrician for that. Some signs that a child might be having middle ear problems are scratches in the ear. You notice little scratches, or if your baby's touching their ear, sometimes it's a very kind of nonchalant way that they keep touching a certain ear. That might indicate that they have a middle ear problem going on. Sometimes we don't even know that there's a middle ear problem present. When children have very high pain tolerances, they may have middle ear infections we don't even know about because they don't respond to pain normally, so watch out for that. If a baby's not babbling by about 6 months of age, saying things like da 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 da, ba 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 ba, what we call canonical babbling, that can be a big red flag that the baby's not hearing properly and could have middle ear fluid. By 6 months of age, babies should be localizing left and right on a horizontal plane for sounds. If your baby's not turning and looking for sounds by 6 months, this is another red flag. The sooner you get these things checked out, the better, because they will pay for these problems for the rest of their life. Children with chronic middle ear problems frequently have reading difficulties, speech and language difficulties, and struggle through school. And there's so much that we can do with early identification. So watch out for those signs, as I mentioned, and I hope that you have a very healthy and happy 2020.